Now, the Ministries of Trade, Employment and Labour Relations are developing a monitoring mechanism to enforce the adherence of safety protocols at workplaces. This follows revelations by the Director General of the Ghana Health Service, DrPatrickAboagye, that workplaces are becoming the breeding grounds for infections in recent times. Ghana's COVID-19 cases stand at 15,472 and 95 people have been killed. Let's take a look at the case count as well as the regional breakdown.
Recorded 15,472 cumulative cases. That is from the first day, the number of people who have ever tested positive. Out of this, 9,146 has come from enhanced contact tracing, which is either for now we're looking more at risk screening, among others. That is also leading to some of the institutional data we are getting, and then some of the testing of contacts. 6,327 has also come from general surveillance. That is for those who present with symptoms that suggest that they may be positive. Of this 15,000, 11,433 have recovered and are home or at their workplaces. Currently, we have about 22 people who are severe, 6 are critical. We've recorded 95 deaths, and so the total number of active cases, which I keep saying the most important number, the people that we need to deal with, those who are sick, those who are waiting, who are either asymptomatic and at home and waiting to recover, stands at 3,947 cases. We had a total new cases of 460, and out of that 34 from 34 districts and 9 regions. And I'll give you the breakdown and I'll show you the averages, because the numbers depends on when the labs are ready and when we stop to report them. So that's why a little string. So now we have averages that tells us what is the routine average of new cases. 64% of these new cases were reported from Greater Accra. And as we keep saying, some of these are mainly institutional outbreaks, and that we're happy that the Minister for Trade is here to shed more light on that, on how we can also prevent it. 36% of them come from the rest of the remaining 8 regions.
Dr. Aboagye has also been speaking about the discharging policy, which has become a major source of concern for Ghanaians following the review.
You can see that we have them by number. Ahafo has only one discharge, but we are hoping that by the end of the week, most of them would have crossed the 14-day threshold, and most of them would have discharged. And it goes on. You can see Ashanti has about 1,995 cases discharged. Greater Accra has 6,696 discharges, coming up to the 11,000 discharges that are so these are the regional breakdown. Upper East is a lot of institutional outbreaks there, and so we are hoping that within a very short time they all move into recovery, and the number of recoveries will significantly show up. Next slide. Of late, we've had the issue of the deaths. So we are looking at the weeks. You know, in epidemiology, this is the year is divided into weeks. We had our first case or first death on the week 12 of the year. And you can see that the orange color is deaths from Ashanti, blue is Greater Accra and others. So the significant majority of the deaths have come from Greater Accra and Ashanti. That's why the map is targeted in that way. You could see that we've had some spikes on week 22 and week 23. By week 24 and 25, which is the week we are in now, the number of deaths has remained roughly about 3 in a week. So that's how it is. So if you see the uploading of 15 or 10 cases, not because they just happened that week or that day. These are some of the after the review. So after the review and looking at the date of death, this is the presentation that it shows. So we saw a little spike in week 22, and now there's been a decline. And we hope that we are able to, with the improvement in the case management and expansion of beds and the congestion of our facilities, we should expect further improvement. Now, we must also add that of the cases who are critical, majority recover. We've had about 36, there's a facility that has received 36 people in ICU and only 3 had died. The rest of the 33 had actually recovered and gone home. So critical doesn't mean death. But if you look at the next slide, which is very important, you could see this is the time of death from that time of admission. That's more than 50–60% of all the deaths occur within 48 hours of admission. And these are the people who report to the facility very, very late.
One of the things you don't want to do is to report to the facility late. Now, let's take a look at where these new cases are coming from. DrPatrickAboagye says the workplace is becoming a notorious hotspot for infections. He says some media houses and mining companies are seeing more of these cases.
Yes, I think it's a great worry, as has been said, and most of our current cases have come from that area, and that's why we've been working hard to ensure that these things are applied. I may not be able to give you the total numbers because some are small. They are quite a lot. We have them at mines. We've got some oil and gas companies that have been affected. We've got some other areas of some government agencies have also been had fallen to some of these things, and even some media houses has also had such outbreaks. And so, but the most important thing is how do we apply some of these protocols to ensure that, because you see, moving from your house into that area definitely means that it poses a threat, because it's like you may go to a place where you have about 200 people working. That's in a sense a crowd, but it's the way you organize yourself in such a way that you apply the social distancing and avoiding grouping, as the minister has outlined, will help us to reduce these things. And so if an organization is deemed at a high risk, it could be added. But now, why you do that? If you have an organization request that I think I want my people tested, we come in to do a risk assessment. Have you had a case? We had 1 or 2 cases. Where do they sit? Who do they enjoy? Then that's how we do the contact trace. So it's done within that. But to come out and say, I have an 18,000 employees, please, we feel at risk, test all of them, it's really not going to be something. So what we do now is that once you make a request, because there's a perceived risk, we come with you and assess the risk, and then based on the principles, identify those to be tested, those to be isolated, and we'll do that according to the science, and not just any 10,000 people, which creates congestion for the system. So just random routine requests will not be what you're talking about.
DrPatrickAboagye there.